Welcome to One-on-One with Walt Lascos. In this brief podcast, you'll learn how to most effectively address senior financial exploitation. Now, here's Walt.
Today we're going to talk about Alzheimer's disease, the most common form of dementia, and what we all need to know when being of service to older adults when they begin to show symptoms of this disease. Joining me is Melissa Grenier. Melissa is the regional manager of the Alzheimer's Association of New Hampshire. Melissa, let's begin our conversation by you sharing with us what we should be looking for in terms of symptoms. You know, what are the most common symptoms that an older adult will start to show that basically is saying that they may be suffering from the beginnings of dementia?
Sure. Well, first of all, thank you so much for having me. I really appreciate the opportunity to share some information about Alzheimer's disease. So the question you have, what are some of those warning signs or what are some of those concerns that people may notice in themselves or their loved ones? Most often with Alzheimer's disease, we see a loss of short-term memory. It's short-term memory loss that we often see first. So an example of a short-term memory would, for instance, be what I had for breakfast or the route I took to work this morning. Whereas a long-term memory would be maybe the street I grew up on or my wedding song or my first pet's name. Those long-term memories tend to stay well intact quite far into the disease process. But what we get concerned about or what we typically see are those short-term memories that start to dissipate and a person is no longer able to remember those things or learn new things. So that is the number one most common symptom. Go for it.
Melissa, I was going to ask, is there a distinction between, when it comes to short-term memory loss? Sometimes you get folks as they get older, they start telling stories about, what it was like back when they were growing up and they remember all these details. Mm-hmm. And then for the short term, some of them may remember some things, may not remember some things. Is there a distinction when we start to see it going down the track of dementia?
Yeah, that's a really good point, actually. So there is a difference between sort of normal age-related memory changes and when a person should be concerned about dementia, which I think is the distinction you're curious about. So there are some mild changes that a person who is aging may experience, whether it's with their memory at all, or whether it's things like their endurance or their strength or their vision. Some of these things are pretty typical age-related changes. What we get concerned about is when memory changes or some of the other symptoms that I'll mention, when those things start to impact a person's overall independence, that is the tipping point. And that's when people should be concerned that this is more than just normal aging. So when memory loss starts to impact a person's day-to-day functioning, where they're not paying their bills, they're not taking their medicine, they're not remembering that they haven't showered for a week, things of that nature, that is not normal aging. That is above and beyond that, and we should be paying attention as family members or loved ones about those changes that someone's experiencing.
Yeah, I mean, it is such a sensitive topic, and it's something that really does tear at the heart, particularly for anyone that has, older parents or even older grandparents, and seeing them at that stage in their life, the golden years when everything is supposed to be wonderful, and you start to see that kind of slipping kind of happen. It really does. I don't know. It is challenging, I should say.
And it's hard to watch.
Oh yeah, my heart goes out to any younger person or anyone that is, that has a loved one like this that's being impacted in this way. That being said, Melissa, what should be the first kind of response that perhaps we as a caregiver or a loved one should do when we start to notice this taking place in an older parent or grandparent?
I think it's okay to open the door to some initial conversations about it. I've noticed that X, Y, or Z is happening, and I'm getting a little bit concerned. Have you noticed that these things are happening, Dad? So if you have concerns, it's completely appropriate to dip your toe in that conversation, to have a subtle conversation to get it started. My rule of thumb is that if the person that you're concerned about gets really defensive when you start asking them questions, then I would back off, from that conversation, but I would continue to pay close attention. And I would also have conversations with other people that your loved one interacts with. So say I was concerned about my father, I would check in with my brother, I would check in with my dad's next door neighbor, and just, subtly, not get into a lot of detail, but just check in and say, hey, I've noticed that he's putting things away in funny places, or he's not doing what he typically would do in his, in his shed or in his garage, when he's tinkering around, or, I'm seeing a lot of bills pile up on his kitchen table, and that's not like him. He's usually really on top of that. Are you noticing these same things, or are you noticing other things? So I think it's important to be honest with the person that you're concerned about, especially if the person is still able to have those conversations, if this process is still in the early part of the journey, so to speak, of dementia potentially. It is important to include that person in the conversation, but also to be sensitive and understand that it's very common for that person to be in denial or to be defensive about what the conversation is about.
Mm-hmm. Oh, yeah, I could certainly understand that, too, because I would think that a lot of older adults, when you look at it, their sense of independence and freedom, and, all of a sudden now, as a child, you're challenging me and saying that, I'm forgetting and I'm getting, I might have dementia, and it's like, I could actually see how it's a natural reaction is to push back or say no. With that in mind, is there anything that can be done once maybe you engage the parent, the grandparent? We have talked about this. They may still be saying no and pushing back. Is there a way that could be brought up, at the doctor's office, for example, of the different kind of testing that might go into diagnosing whether or not the individual is suffering from dementia?
Yeah, absolutely. I think one thing that you said that I want to highlight is that getting the person to the doctor, although it can be sometimes a little bit of a struggle if the person is resistant to knowing whether it's dementia or something else, I think it is crucial to get that person to the doctor at some point, sooner, hopefully, rather than later. And I think it is important to ask your loved one if it's okay if you join them in the exam room for at least the initial part of the visit where you're having a conversation with the doctor. If your loved one does not feel comfortable having you join them in the exam room, then what I typically do is recommend that caregivers write down or type up their concerns to give to the office manager or the receptionist so that they can give it to the doctor, and the doctor walks into that conversation with your loved one, with the knowledge that the family members have some concerns about memory changes. So we want to either in person in the exam room with your loved one, maybe express some concerns then, but if that doesn't seem like it's going to be possible, then communicate that to the staff ahead of the appointment, or just as the medical assistant takes mom or dad or whoever back to the exam room, you can have that conversation or give that piece of paper with the information to the staff so that the doctor goes in, like I said, with more information. That's
a very great idea and suggestion, Melissa. I do love that because it's a nice way to get that information to the doctor kind of in a confidential, private manner so that the doctor is prepared then to be sensitive and to look for it, him or herself, when they get in front of the patient, and how to at least be able to gauge whether that individual is indeed having episodes of dementia or is being challenged by it. In our little time that's left, tell us a little bit about treatment today and how folks are coping with Alzheimer's. Is it something that you see trending more and more in today's society? And with that being the case, How are the medical implications for this? Is modern-day medicine helping to at least be able to control and manage some of these symptoms for older adults?
Yeah, so Alzheimer's disease, being the most common type of dementia, is growing it's growing in terms of the number of people that are developing it, but it's most likely caused by the fact that baby boomers are aging at a rate of 10,000 people per day are turning 65. And when we're talking about someone who's more at risk of developing dementia, it's a person over the age of 65. So in New Hampshire, for instance, we have 26,000 people living with Alzheimer's disease. Now, that might not sound like a ton of people, but in New Hampshire, we don't have as robust of an infrastructure for caring for people with chronic illness than some of our neighboring states or states in other parts of the country. So we do need to take it seriously because we do have a growing number of people in the country as well as in New Hampshire that are dealing with this. In terms of treatments, historically, there have been several FDA-approved medications to help with the symptoms of the disease. So that can make things feel a little bit better for the short term, and it works the best the earlier in the disease process that those medications are introduced. So things like Aricept and Namenda. But recently, last year, a brand new disease-modifying treatment called Leqembi came to market, and that's an infusion medication. So someone would have to go to the hospital to be infused with an IV, and they'd have to sit there and receive the medication. But the great part about that type of treatment, although it's more invasive and unfortunately more expensive at this time, that medication actually dissolves the plaques in the brain that result in Alzheimer's disease. So Alzheimer's disease, the two main, I call them brain gunk, the two substances that build up in the brain are plaques and tangles. So Leqembi, which is that new infusion medication, actually helps to dissolve some of the plaques in the brain that end up killing brain cells and causing a person to have functional loss. So it's actually changing the course of the disease, which we've never had before. So it's really exciting.
Wow, that's great to hear that kind of news coming out about being able to combat it by scraping away some of that plaque within the brain, because that is, as you say, the basic contributor to the disease itself. As we wrap, any kind of key things that you really want a listener to know about dementia, Alzheimer's disease, as to if they do notice it, whatever, for dealing with an older adult, that they should always, like the number one or two things to always be aware of? What would you suggest?
I would say as a person ages, just pay attention for changes that do impact a person's independence. I think that's again is the tipping point between what we talked about with normal aging and when we should be concerned. So let's keep our eyes peeled. Number two would be, even if a person gets diagnosed with Alzheimer's, there's a lot of life to be lived. So I think 20 years ago we only thought of really older people as having Alzheimer's. Well, now there's people in their 40s and 50s. So, and they live great quality of life, of their lives. And I think that it's not automatically, someone doesn't automatically have to become a hermit and not live the rest of their life. We want to encourage people to live the best quality of life that they can. And the Alzheimer's Association, as a side note, is here to support people living with any type of dementia. And we have a toll-free helpline number that people are welcome to use. I don't know if that's something I can mention now, Walt.
Yes, please do.
Okay, so the Alzheimer's Association's toll-free 24/7 helpline is available at 1-800-272-3900. And if you call that number, you'll be connected to the local Alzheimer's Association chapter that's closest to you.
Wonderful. Melissa, thank you so much for joining us today on our podcast and for sharing such valuable information, with all of our listeners. I really do appreciate it. Thank you so much.
Thank you so much for having me.
And thank you all, too, for listening. Stay safe.
If you've enjoyed this conversation, don't forget to follow One-on-One with Walt Laskos wherever you get your podcasts. Feel free to send comments to walt@laskoscommunications.com. And to learn more about how you might support the prevention of elder financial scams, visit laskoscommunications.com.